Welcome to the deep dive. Today, we're tackling something huge, chronic pain. I mean, low back pain alone. It's the top reason people miss work globally.
Yeah, and in the U.S., we're talking, what, $90 billion a year spent just trying to find some relief?
90 billion. It's astronomical. And, people are looking everywhere for solutions that aren't just pills.
Exactly. So today we're doing a deep dive into one of the most common and, let's be honest, most controversial non-drug approaches, chiropractic care.
Right.
We've looked at everything from medical reviews, clinical guidelines, even old court documents, and, skeptical critiques. We want to pin down what chiropractic is today.
And how it's still sort of wrestling with its own past.
Mm-hmm.
So our sources define it basically as therapy focused on body structure, especially the spine, using manipulation, adjustment.
Yeah, adjustments often combined with other things like exercise advice, maybe nutrition, posture work.
But it always seems described as being at this crossroads of mainstream and alternative medicine.
That's the perfect phrase for it, really. We need to unpack the modern science, but you can't do that without first digging into the history, the philosophical roots that are still causing friction.
Okay, let's unpack this then. Where does all that controversy start? Why is there still this, fundamental tension?
It goes right back to the beginning. 1895, a guy named Daniel D. Palmer. He was actually a magnetic healer into spiritualism.
Okay.
And he came up with this big idea, the vertebral subluxation. He believed that a tiny misalignment in the spine was the single cause.
The single cause?
Yes, of total diseases.
Oh.
Because it supposedly pinched nerves and blocked the body's innate intelligence from healing itself.
Wow, okay, that's a massive claim. All disease, from a cold to cancer, caused by one slightly shifted bone.
That was the original idea.
Yeah.
And the only cure, spinal adjustment.
So how does a profession based on that idea even begin to mesh with, modern science? It seems impossible.
Well, that's exactly where the split happens. The schism formed early on, and honestly, it's still there today. You've got the straights.
The streets.
Yeah, they stick really closely to Palmer's original philosophy. Vitalism, innate intelligence, subluxation as the root of all illness. They often operate, quite separately from mainstream medicine.
Okay, and the other side?
They're called the mixers. They're more pragmatic. They integrate other techniques, focus on musculoskeletal problems where there's actual evidence.
Right, like back pain, neck pain.
Exactly. They use exercise, massage. They acknowledge that structure isn't the only thing affecting health.
So the straights are still championing this subluxation theory, even though, the scientific community seems to have largely dismissed it.
Pretty much. The original bone on a nerve idea just didn't hold up physiologically or anatomically.
How so?
Well, anatomists pointed out early on that for a bone to shift enough to truly pinch a spinal nerve like Palmer described, you'd probably be severely disabled. You wouldn't just walk into a clinic feeling a bit off.
Right, okay, that makes sense.
So as the criticism grew, the concept got, fuzzier. It evolved into the vertebral subluxation complex, or VSC.
Which sounds more scientific, maybe.
It sounds more complex, certainly.
Right.
But critics argue it's still not scientifically validated. It's almost become this circular definition. A subluxation is simply whatever a chiropractor adjusts.
So that philosophical baggage, that yoke, as some sources called it still weighs things down.
It definitely does, even for practitioners who really just want to focus on evidence-based pain relief.
Okay, let's shift to where there is solid ground, scientifically speaking, because, as we said, people need effective pain relief, especially for low back pain.
Absolutely. And many conventional treatments, frankly, have been disappointing. Opioids obviously have huge problems. Spinal fusion surgery often doesn't work long-term. Steroid injections give only temporary relief.
So medicine started looking elsewhere.
Increasingly, yes. And ironically, the opioid crisis kind of forced the issue. Mainstream guidelines had to seriously consider non-drug options.
And that's where chiropractic manipulation comes back into the picture.
Exactly. Major groups like the American College of Physicians now actually recommend spinal manipulation as a first-line treatment for acute low back pain.
First line. That's huge. Alongside things like heat, massage, acupuncture.
Correct. Moving from the fringes right into the primary recommendations for initial care.
But there's often a qualifier, right? The word modest keeps popping up regarding how effective it is. What does modest actually mean for someone in pain?
Yeah, that nuance is really important. We're talking about spinal manipulative therapy, SMT. That covers both the classic adjustment, the quick thrust, sometimes with a crack, and mobilization, which is slower, more passive movement. For acute low back pain, the reviews show SMT leads to, well, modest improvements in pain and function.
Okay, modest for acute. What about chronic low back pain, the kind that lingers for months or years?
That's where it gets even more complex. For chronic LBP, studies often show that while SMT might give some immediate relief, the long-term differences compared to other active treatments or even sometimes a placebo are often quite small.
Smaller.
Like maybe a 10-point drop on a 100-point pain scale after, say, 3 months. It helps some people, definitely, but it's not usually a cure-all.
And that makes sense when you think about our modern understanding of pain, especially chronic pain. It's not just mechanical, right?
Not at all. LBP is now seen as this complex biopsychosocial thing. Structure plays a role, sure, but so do psychological factors like fear of movement, depression, anxiety, and social factors like work environment, support systems.
Which explains why just focusing on adjusting the spine might not be enough for long-term chronic cases.
Precisely. It validates other approaches too. Think about Dr. John Sarno's work back in the day, focusing on the mind-body connection, basically early cognitive behavioral therapy for back pain.
Right, addressing the fear and tension associated with the pain.
Or experts like Stuart McGill, the spine biomechanist, sometimes called a back whisperer, who emphasizes very specific, personalized exercises like his Big Three to build core stability. These address the whole picture.
Okay, let's pivot back to specific chiropractic techniques, especially those that are maybe more controversial, even within the profession. Chiropractic biophysics, or CBP. What's that about?
CBP. Yes, that's a very specific approach. It aims to physically change posture to match a mathematically calculated ideal spinal curve, the Harrison spinal model.
An ideal curve for everyone.
That's the premise. And it relies heavily on X-rays. Lots of them. They call it row in genomics, detailed measurements of spinal angles from X-rays. They use this to develop treatment plans, sometimes even for people who don't have any symptoms.
Wait, treating people with no symptoms based on X-ray angles?
That's one of the criticisms, yes.
Okay, so if standard manipulation has modest effects for chronic pain, why go for something seemingly so intensive and, well, based on an ideal that might not fit everyone? What are the main criticisms?
There are a few big ones. First, the scientific validity of that ideal Harrison model itself is questioned. Other research suggests the curvatures CBP tries to correct are actually within the normal range for many healthy people.
So correcting something that might not need correcting.
Potentially. Second, the treatment plans are often very long and very expensive. We're talking initial plans of maybe 6 to 12 months,
Wow.
often followed by recommendations for monthly maintenance adjustments for life.
For life, that's a serious commitment, financially and time-wise.
It absolutely is. And the third, and probably most significant criticism, is about the evidence for outcomes. While CBP focuses intensely on changing the physical structure, the spinal curves,
Yeah.
there's not strong scientific proof that achieving those specific structural changes actually leads to better clinical outcomes. Meaning, does it reliably reduce pain or improve function long term?
So the link between changing the X-ray and feeling better isn't clearly established.
Not robustly, according to critics and many systematic reviews. And because of that lack of proven clinical benefit tied directly to the structural changes, many insurance companies, like Aetna, for example, classify CBP as experimental and investigational. They often won't cover it.
Okay, that's important context. Let's talk safety. Low back manipulation seems very safe, right? The risk is tiny.
For the lumbar spine, yes. Serious problems are incredibly rare. The figure often cited is something like 1 complication per 100 million manipulations. Extremely low risk.
With the neck, that's different. Cervical manipulation.
That's where the conversation gets more serious, definitely. There is a risk, although still statistically low, of things like stroke or vertebral artery dissection that's a tear in an artery in the neck.
How high is that risk? The numbers seem to vary a lot in the sources.
They do vary. Estimates range from maybe 1 serious event in 400,000 adjustments up to maybe 1.5 strokes per million adjustments. So still low probability, but clearly higher than the low back, and the potential outcome is devastating.
And part of the problem is figuring out cause and effect, isn't it? Like, did the adjustment cause the stroke, or was someone already having early stroke symptoms, like neck pain, and then sought care?
That is the absolute crux of the difficulty in assessing the true risk. Neck pain or headache can be the first symptom of an artery dissection or an impending stroke. So if someone seeks care for that pain, gets an adjustment, and then has a stroke, was it causation or just correlation? It's often impossible to know for sure.
But because the stakes are so high.
Exactly. Because the potential harm is so severe, There's ongoing caution and debate, particularly around high-velocity thrusts to the neck.
This risk element, combined with the philosophical debates we talked about, must have fueled the historical conflict with mainstream medicine. The AMA, the American Medical Association, was really antagonistic for a long time.
Oh, absolutely. For decades, they officially labeled chiropractic an unscientific cult. Until 1980, their code of ethics actually stated it was unethical for medical doctors to associate professionally with chiropractors.
Unethical to even refer a patient or consult.
Yes, it was a complete boycott, essentially.
Yeah.
An organized effort, as the courts later found, to contain and eliminate the profession.
And this led to a major legal battle.
It did. The landmark case, Wilk v. AMA. It was filed in 1976, dragged on for years, and was finally decided in 1987. Chiropractors sued the AMA, accusing them of an illegal conspiracy, basically violating antitrust laws.
And the chiropractors won.
They did. The federal court ruled that the AMA had engaged in an unlawful conspiracy, a boycott aimed at destroying a competing profession.
What kind of impact did that boycott actually have? Did the court hear specific examples?
Yes, the trial testimony really highlighted the real-world effects. Dr. Patricia Arthur, one of the plaintiffs, described trying to set up practice in Colorado. The local hospital administrator told her point blank she couldn't have privileges for x-rays or lab work.
Why not?
Because, he said, the hospital accreditation body, the Joint Commission, might pull their accreditation if they associated with a chiropractor. It effectively blocked her ability to practice fully.
Wow, denial of basic tools.
Crippling, right. Another plaintiff, Dr. James Bryden, testified about a medical doctor he worked with, Dr. Jerome Block. They had a referral relationship, which is crucial for complex cases. But Dr. Block was forced to end it. The hospital's ethics committee threatened his position, his hospital privileges, if he kept working with a chiropractor. It directly harmed patient care and professional collaboration.
So the lawsuit wasn't just about professional rivalry, it was about patient access and the right to practice.
Absolutely. And winning that case was pivotal. It broke the back of the AMA boycott and really paved the way for chiropractic to become more integrated into the broader healthcare system.
How did that integration play out?
Well, after the lawsuit, things started changing. Chiropractic care got included in most state workers' compensation programs. More private insurance plans started covering it. It was actually already a Medicare benefit since 1972, believe it or not.
Oh, interesting.
Though chiropractors are still fighting for broader coverage under Medicare. But significantly, Congress mandated its inclusion in the Department of Defense and the VA healthcare systems.
So military personnel and veterans have access.
Yes, and now there are even chiropractic residency programs within the VA where chiropractors train alongside medical residents. That's a huge shift from the unscientific cult days.
Definitely. So wrapping this all up after this deep dive, it feels like we're looking at a profession with two faces, almost.
That's a good way to put it.
On one side, you have solid evidence for helping with certain things, especially acute low back pain. It's recommended in guidelines now.
Right, the musculoskeletal evidence-based side.
But on the other side, you still have this internal struggle over the original philosophy, the subluxation theory, which lacks scientific proof, and other controversial stances some chiropractors take, like on vaccinations.
That internal conflict is definitely still present. But maybe, amidst all that, what often gets overlooked is the patient experience.
What do you mean?
Study after study shows that chiropractic patients report very high levels of satisfaction with their care, way higher than often seen in conventional medical encounters, especially for chronic pain.
Why is that, do you think?
A lot of it seems to come down to the nature of the visit. It's often described as high-touch, low-technology. Patients feel heard, they get hands-on treatment, they feel someone is taking their pain seriously and giving them a framework to understand it.
So that feeling of validation, of being understood, is therapeutic in itself.
For someone dealing with chronic pain, absolutely. It can provide a sense of meaning, empowerment, a feeling of taking control, which can be incredibly valuable, even if the specific theory behind the adjustment isn't scientifically proven for non-musculoskeletal issues.
That focus on the patient relationship, the hands-on care, it offers something that maybe a quick prescription or a brief medical consult doesn't.
Exactly. It meets the need for connection and understanding in the healing process.
Which leads us perfectly to our final provocative thought for you, the listener. When you're considering any kind of long-term or expensive treatment, especially for something persistent like chronic pain, What should weigh more heavily in your decision?
Should it be the scientific validation of the theory behind the treatment? Like, do we know exactly how it works mechanically or physiologically?
Or should it be the proven effectiveness of the clinical encounter itself? The compassion, the hands-on approach, the sense of partnership and empowerment it provides, even if the underlying mechanism isn't fully pinned down, which factor ultimately determines the real value of care for you?